What's up guys? Welcome back to another penny stock video, but this time it's BlackRock purchasing this penny stock. But what's even crazier is they just purchased even more shares at the latest quarter. And when we see massive hedge funds like BlackRock, Vanguard, and also State Street purchasing penny stocks, it's generally a pretty good sign since a lot of these major institutions, I checked virtually every single stock they've bought in the past couple years, and they almost never buy penny stocks because these guys like to invest in very stable, very well-made companies. And penny stocks usually are not good companies, and this is why they drop from several dollars to just a couple dollars and sometimes even pennies. But of course, since BlackRock is purchasing this penny stock, and it is a penny stock that most people just simply don't know. And the volume is super low, by the way, meaning that most people just never even heard about this. And before we dive in deeper, please do not YOLO your whole portfolio into a penny stock. I know it may sound very tempting, especially when you see other people do it, but just to know that doing this, you have a chance of busting up your whole entire portfolio. So no more than 15% of your portfolio. Long story short, BlackRock is purchasing a ton of SPPI stock. This is a pharmaceutical stock. And at this current moment, BlackRock has 26.4 million shares. And in the past quarter, they added in 7 million shares. This is a 36% increase of SPPI. This is insane. And usually you see BlackRock massively selling off their old penny stocks. This is like a gem in a haystack here because you rarely even see major institutions buy penny stocks. And what's even rarer is you never see them increase their positions this massively. If you go all the way on the top, it says BlackRock. And if you go all the way down bottom, it says healthcare, SPPI. They just purchased even more, and now their position is 26 million shares. This is absolutely crazy. SPPI is Spectrum Pharmaceuticals. No, it's not the internet company, but I'm not gonna lie though, both of them seem pretty bad if you look at the overall line and also their Wi-Fi. These guys started off at $22, $24. It's like a price of a really nice steak. Now it's like a price of a quarter pounder of cheese. And the stock price has been dropping, but what's really interesting is BlackRock has purchased even more shares recently. I think they're pretty much betting on some FDA approvals for 2021, which we will get into. Now, this is a pharmaceutical company with pretty decent market cap. It's $500 million. Obviously, $500 million isn't a lot of money, but for a penny stock like this, it's really not that bad. They have several employees. They're based in Nevada. They have a pretty long history, founded in 1987, and their average volume is only 1.67 million. Compared to stocks like GEVO, their volume is 30 million. I think the reason why a lot of these other penny stocks out there, pharmaceutical, material, 3D printing are going up is because of increased volume and increased hype. When there's more hype on the stock, share prices go up. SPPI, BlackRock is very, very quietly increasing more shares, and the volume is super low at 1.67 million. If you check out all the other penny stock hype trains, the volume is at least 10, 20, and sometimes even 30 plus million in a single day. Whereas these guys, it's super low. So Spectrum Pharmaceuticals, these guys are a pretty decently well-sized stock. They have a few drugs in advanced development, and so far they are starting a lot of clinical trials. If you check out what their company is all about, they are a pharmaceutical company that focuses on acquiring, developing, and also commercializing several cancer drugs essentially. And they also have a lot of late stage pipeline drugs and also assets already available. Spectrum Pharmaceuticals already has 2 drugs in advanced development. One of them is Rolantis. The other one is Posiantabib. Try my best to pronounce these because it's really hard to pronounce some of these drug names. But anyway, if you check out some of their products, it's pretty awesome. And their drugs really are in some advanced phases. A lot of time when you check these penny stocks, their phases are like phase 1 or preclinical, whereas Rolantis right now already has some of them in the phase 3 trials, and you have Posiantabib, which is already at the phase 2 trials. Now, they obviously have other drugs out there, but what I really like about this is they have more than one drug in development for the pipeline. It's very dangerous when a pharmaceutical company only has one drug that's banking on FDA approval, and that's pretty scary. And I think the reason why BlackRock is betting pretty big on this is because these 2 drugs have a ton of potential. They already went through several clinical studies, and they actually came out and said the results are pretty good. And it's not just one drug, there's 2 drugs. So at least if one of them gets fully approved, the share price will still go up even though the others might have failed. On top of that, there's a ton of other major institutions buying onto this penny stock. It's not just BlackRock, but BlackRock does have the biggest ownership in the company of 18%. Now you do have Vanguard, they are cutting their shares a little bit, but State Street has increased it, and then you have Morgan Stanley over here increasing shares by 260%. So you have the majority of the major institutions increasing shares. It's really scary when you see the majority of institutions cutting their shares. If you see a ton of red in the quarterly change shares, that's a bad sign. But with essentially 90% of all institutions increasing their shares dramatically, I feel like most of these guys know what's going to happen with this company. If you look at some of the results, it seems pretty good. And there's a lot of good news, especially how Spectrum provides Fosinatamab update after a successful pre-NDA meeting. And this is with the FDA. And this is great news because so far they got this step across. And at this current moment, you do have Hanmi Pharmaceutical, which is expecting US FDA approval for 2 new drugs. And one of the drugs that Spectrum Pharmaceuticals is working with is Rolantis. Now, this is a drug for neutrophobia, and its technology is licensed out to Spectrum Pharmaceuticals. More good news for Spectrum Pharmaceutical, especially how this pre-NDA meeting with the FDA was really successful. And you already have several of these drugs in their pipelines going to the next phase, the next step. There's good news. The preclinical trials are good. The current clinical trials with several patients turned out to be pretty wonderful, with none of the patients having any sort of like a super big side effect against the drugs. If you also check out Hanmi's cancer drug Fosinatamab, it will be filed for approval for FDA next year. And this is the article in late December 2020. So we should be seeing 2 drugs this year that might be having FDA approvals. Not just 1, but 2. And at this current moment, Spectrum did receive an exclusive license grant from Hanmi Pharmaceuticals to develop and also manufacture these different drugs worldwide. 2 researchers over here, and you do have Spectrum Pharmaceuticals going to be raking in the dough by manufacturing and commercializing this drug. On top of that, you do have a bunch of approvals from the FDA. The clinical studies are going extremely good. I mean, check out some of these articles. It has layers and layers of really good clinical trials and decent reports. And so far, Fosinatamab achieved a really good response rate of 55%, which is probably one of the best you could hope for. What's going to happen with Spectrum Pharmaceuticals and how I feel about this? I think this is a pretty decent stock, especially how BlackRock is going so heavily into it. Now, obviously, though, like any pharmaceutical stock, be very careful. But also keep in mind that in the past 5 years, it's at an all-time low. I mean, I don't really think these guys can go any lower than like $3 or $2. But then again, though, if BlackRock is buying so many shares, I think they're banking their money on FDA approval for the 2 drugs. These 2 right here. And if just the FDA at the very least approve one of these, the share price will go up. Now, usually with a lot of pharmaceutical stocks, after the approval, share prices shoot all the way up, and then you have a massive sell-off. But there's also times all the way back in 2016 with Spectrum Pharmaceuticals is these guys, they go from like $4, $3 all the way to the peak of 19 and eventually all the way up to $22. And I think BlackRock is banking on the fact that these guys will be repeating what happened several years ago, being at $3.50, $3.60 all the way up to $18 as more and more good news comes in, as more and more news about FDA approval is becoming more imminent. I think people will plow into the stock. Now, one of my biggest things about this is the volume isn't super high, meaning that once people find out about this, most people will start buying this penny stock. Now, most penny stocks that usually do pretty well have very good volume. 20, 30 million is extremely healthy. If you check out BNGO, for example, these guys have enormous volume for a penny stock. Like, look at this, almost 200 million in a single day. I'm pretty sure if you put like 50 million on SPPI, the share price will absolutely go up. Right now, this is a pretty low-key stock. There's several other major hedge fund guys piling in. And also, I don't think I've ever seen a penny stock with this many hedge funds in it. Usually you don't see more than 10 or 20, but here we see like 50, 100, 150 of these guys. You have several major institutions being really well recognized, having really good track records. I'm pretty sure they made the correct decision here. That's about it, guys. Thanks for watching. Comment below. How do you guys feel about BlackRock's decision to increase their shares on SPPI? Would you guys go in? How do you guys think about this pharmaceutical stock? By the way, please don't put your whole portfolio into SPPI. Definitely be very conservative, no more than 15%. That's about it. By the way, check out the free Discord server in the description below with more than 23,000 members. It's completely free. There's a Patreon link below for exclusive chat room perks. And also my second channel, which mostly focuses on electric vehicle news. Definitely check that out. Thanks for watching.